All I could think about was a seizure I had after giving birth to my first daughter. I wasn't sure I would survive after that. While pregnant with my second daughter, I had to go to the emergency room. I could barely stand to walk because my ankles and hands were so swollen. I was sent home twice after having high blood pressure at 36 weeks pregnant. It was preeclampsia. I did not have protein in my urine, and it seemed like all the other symptoms I was having did not matter to the doctors. No one seemed to listen to me or ask what I needed, including the father of my child. When I had to go back to labor and delivery for the third time, I was praying that I'd be taken seriously. But I had little hope that I would be heard. I had dangerously high blood pressure and was being observed for a few hours. They made the final decision to induce me. Although I was relieved, I felt like I was experiencing another traumatic event instead of another best day of my life. The nurses came in and explained a lot of overwhelming information to me. I'd be put on a catheter and be given a very high dose of medication that would cause me to be very out of it. If I had to go number 2, I would have to use a bedpan. They also explained to me that once I gave birth, they would be taking my baby into the NICU because the medication they were giving me for my blood pressure. They said it would make me unable to care for my baby right away. The nurses were not warm and reassuring to me at all. They acted as if I was the problem. That made me not want to call them in for help or ask very many questions. There I was, all alone. The father of my children was focused on all the wrong things. The medicine they were giving me caused my blood pressure to plummet so low that I thought I was going to die. Brendan Ellers, they shouted on the loudspeaker, trying to get the father back in the room because our baby was coming. He did not make it into the room in time. And then there she was, my beautiful little 5-pound, 10-ounce baby. So very healthy. All of this struggle was so worth it when I heard her first little cry and gave her her first kiss. I was madly in love and so relieved this was all over. I gave her one last kiss and the medicine drifted me into a deep sleep, as my daughter was taken to the NICU. And now I have 2 lovely little girls so full of life. But I keep asking myself, why wasn't I taken seriously the first time I came in with concerns?